Hello. Hello. Hello everyone. A pleasant good afternoon. Are you all tired? Okay, so wala po akong magagawa but you have to listen. Ayun lang po. Anyway, last but not the least, pero syempre since huli ako, I just want to sum up all the reports. O, di ba? Yabang. So, anyway, in Japan, minasan konnichiwa. Okay. So, since nasa Bisaya tayo, maayong hapon. Ayan. So, a pleasant good afternoon to each and every one. Sa Japan, to follow. Ay, sa India, to follow po. Mamaya na lang sa MP. Anyway, welcome to the 3rd Nemoto End User Conference. I am Henry Yevgeny. Na-pronounce ba ng tama kanina? Ayan. Thank you so much. Henry Yevgeny B. Triñanes, the Assistant Chief Radiology Technologist from East Avenue Medical Center, Quezon City, working under the supervision of Ms. Alma Molano, my Chief Rad Tech. Today, I am excited to present our case study for the Nemoto 3D Liver Contest. This presentation will showcase how our department utilizes the combination of two. Okay, what is this? The United Imaging Healthcare CT Scan Machine, UCT 528, in combination with the Nemoto Dual Power Injector. A round of applause, please. Yan yun. To deliver, take note, the precise and comprehensive imaging for complex liver cases. Are we? Okay. So, at the CT scan section of East Avenue Medical Center, our department, we use actually nga, yung sabi ko kanina, the United Imaging UCT 528 CT scanner. Okay? So, known for its high-resolution imaging capabilities to ensure optimal image quality, especially for liver and abdominal studies. We rely on the Nemoto Dual Power Injector for controlled and accurate contrast delivery. Okay? That is the main objective of this power injector. Now, for this case, we use iopamidol Scanlax, as the contrast agent with a concentration of 755 mg per ml and 370 mg of iodine per ml. Okay? So, for this case, the contrast was delivered at the rate of 3.5 ml per second with a total of 100 ml of contrast. Okay, followed by the 95 ml normal saline solution at the same rate of 3.5 ml per second. Okay, so this precise contrast injection protocol aligned with the patient of 70 kg body weight ensures consistent and thorough visualization of the liver structures, which is essential for 3D imaging. So, let me now introduce the case. So, this is the case. The patient is 70 kg male who presented with a 3-month history of right upper quadrant pain radiating to the back. 2 days prior to admission, the patient pain had increased to 10/10 severity. So, lumala siya. And was accompanied by jaundice, fever, and significant weight loss. So this is the actual request of the patient. Given these clinical pictures, there was a high suspicion of hepatobiliary pathology promoting the need for detailed imaging. The goal of this abdominal CT scan was to confirm any hepatic or biliary tract obstruction to assess the extent of any potential liver disease such as tumor or abscess. Okay. So, to investigate, this is our CT scan protocol. To investigate this, we employed a CT pancreatic protocol of the abdomen, which is also suitable to detailed liver imaging. This protocol includes the following key phases. As you can see, we have here the non-contrast phase. So, these serve as a baseline to differentiate any calcifications or stone that may be presented and to assess the liver without enhancement. And 4 seconds after the introduction of the contrast agent, which is the early arterial phase, focus on capturing hepatic arteries and early arterial enhancement, crucial for detecting arterial phase lesion and vascular anatomy. So 24 seconds after the introduction of the contrast agent, this is the late arterial phase. Now, this phase allows us to visualize tumor that may become more visual due to arterial blood supply, especially hypervascular lesion in the liver. And 60 seconds after the introduction, this is the portal venous phase, critical for assessing the liver parenchyma and portal veins, and it helps detect masses, metastases, and liver parenchymal diseases. Okay, so 5 minutes after the introduction of the contrast agent is the delayed phase. So, in the delayed phase, captures delayed contrast enhancement in the liver, useful for detecting late enhancing lesion or feature assessing biliary obstruction. So, these are the phases. Actually, if you want to request for a video, the video was presented as per request because of the limited time. But as per organizers, the video, pwede play? Okay. AVP, presentation, play, move, okay. Okay, just enjoy the video. Oh, wow. Okay. So actually, each phase was carefully timed based on the contrast agent delivery, ensuring that the liver and other abdominal organs were visualized with optimal contrast enhancement. That is the very yung objectives ng ating power injector together with our CT scan machine. Okay? So, while presenting, after the contrast enhanced CT scan was performed, we processed the images through a 3D reconstruction system using the United Imaging UCT 528 and the precise control of the Nemoto Dual Power Injector. We were able to create highly detailed 3D representation of the liver and the surrounding structures. So as you can see, this is actually allow us to clearly visualize the liver parenchyma, bile ducts, and vascular anatomy, offering critical insights into the patient's condition. The images showed a clearly biliary obstruction along with evidence of the hepatic lesion that were well enhanced in the late arterial and portal venous phase. The 3D reconstruction provided the surgical and medical teams with a comprehensive roadmap for treating and for the treatment and planning. So, ito na yung 3D. Now, with regards to the rad tech role in precision imaging, as a rad tech, the Nemoto Dual Power Injector played a crucial role in this case. Its precise control of the contrast flow rates ensures that we achieve consistent and optimal enhancement during each scan phases. So yun naman ang tulong ng RadTech with the medical team. The use of saline chaser after the contrast also help to minimize artifacts, improving overall image clarity, particularly in the delayed phase of this procedure. Okay, so furthermore, the United Imaging UCT 528 CT scanner provided high-resolution images which, when paired with the carefully timed phases of contrast administration, produce outstanding trade labor reconstruction. These technologies combined allow for a significant importance or improvement in the diagnostic accuracy, especially for complex liver and pancreatic cases. Okay, now, in summary, this case demonstrates the capability of the United Imaging UCT 528 CT scanner and the Nemoto Dual Power Injector in producing precise, high-quality 3D liver imaging by following a detailed contrast protocol tailored to the patient's body weight and clinical history. We were able to provide essential diagnostic information that guided the patient's subsequent management. Okay, now our participation in the Nemoto 3D Liver Contest highlights the importance of technology, first, second, teamwork, okay, the collaborative. Actually, the East Avenue Medical Center, we have the private partner, PPP, which is the public-private partnership of the government. Because we cannot afford to buy the CT scan machine and some other imaging modalities which is under state-of-the-art. So our private partners provided the state-of-the-art machine for us. That's why we need a teamwork. And meticulously imaging protocols in modern radiology. So that is the three importance in this world: the teamwork, technology, and imaging protocols. Now, these advanced tools not only enhance diagnostic accuracy, but also improve patient care by providing clearer, more detailed images for clinicians to work with. Yes or no? Okay. Now, to close, but before I close, thank you for your time. Before I close my presentation, please allow me to acknowledge our beloved chairman, none other than Dr. Alfredo Madamba. Palakpakan po natin. Ayan po siya. And after the chairman, sige lang, okay lang mag-sound. Kaya ng boses ko yan. Anyway, our training officer, none other than Dr. Francis Villanueva.
Ayun,
So, and my Chief Radiology Technologist, Miss Alma Molano. Well, this presentation is a product of teamwork with contribution with our Chief Radiology Technologist, Mr. Elmer Cruz and Miss Alliana De Leon, our Senior Radiology Technologist. Okay? I am happy to take a question since I already acknowledged the team from the Chairman, Training Officer, and Chief Radiology Technology. Okay? I am happy to take all your questions. Is there any question from the team?
Dr. Goshima, would you like to raise some questions to Sir Henry?
Okay, good talk.
Thank you.
Very good talk. So you demonstrated traumatic patient, right?
Yes.
And so actually, so do you find any traumatic lesion in the liver in this patient? So any traumatic lesion in the liver? So did you find any traumatic area?
Traumatic area.
Yeah.
Actually, can you play the video dun sa post, ano? Let's check.
Yeah.
So based on the video, this case actually is a, ayan. So, limited po. So if you want to know a deeper, so let's see the video. We have here our radiologist to explain for the... Wait lang. This is my justification. I am a radiologic technologist and I am not allowed to discuss anything.
May bala ka.
Dr. Madamba, I think Henry presented a different case and a different image. Sorry for that. And you were asking about this image, if there was trauma. I'm not really sure of the history of this patient. So it doesn't really match because I think there was a mistake on the image and the history.
Okay, so yeah, I experienced much more cases of traumatic patient in my institution. And so the important thing to perform a CT for traumatic patient is to detect the anatomical anomaly. So okay, you understand that hepatic artery is not only one. So sometimes the branch is fed by directly from the aorta or right renal arteries. So followed by the traumatic situation, patients need to have an angiography to the arterial embolization, right? So before that, we have to know the anatomical situation of the patient. That's my comment.
I agree with you. I also do angiograms, and usually I prefer a CT angiogram before doing the catheter procedure. And I'm sorry again. I think there was mixed up in the case in the images. Okay. So, but East Avenue, I'm kind of proud to say. This just on a side note. We do like 80 to 100 patients a day. We have 3 CT scanners. Patients means 2 or 3 procedures.
Okay.
So we do like 120 to 140 a day.
Okay. Thank you. Thank you.
Is there any questions? Ma'am Bergie, yes?
Wait lang ma'am, magpa-follow up lang ako dun sa sagot. Okay, so actually, if sir, you're asking for a trauma, based on history, the requesting physician for the provisional diagnosis to consider preliminary mass. Okay, so most probably this patient is not a trauma case. Yeah, thank you. Yes, ma'am.
Good afternoon, Sir Henry. I have a question. How many kinds of contrast media do you use? I don't think you use only one kind of contrast media. Or
In East Avenue Medical Center,
Yeah.
we have 3.
okay, I understand that one contrast media has different, like yung concentration. How do you compute the dosage you give to your patient and the normal saline solution to have an excellent image? Well,
basically, the computation of regardless of the age, it's
I mean, the
weight.
concentration, we have 330, we have 370, and we have sometimes 300. How do you compute?
Well, depends on the preparation. Since this preparation na present ko is
You use iopamidol for that?
Yes.
Yeah. And iopamidol has 370 concentration. And how about if you use 350 or 330? How do you compute?
Okay. So, would you like to say something, Ma'am Agot? Sige. Actually, teamwork is very important. You know? So, I need a participation ng participants. Kaya kayo participant, diba? You have to participate. Okay, Miss Agot, please.
Sagutin ko lang po yung tanong kay ma'am.
Yes, ma'am.
Yung sa body, pagkukubit po ng contrast, depende po yung sa body weight ng pasyente. Nagdidepend po nga.
Nawala yung mic. Okay, so any more question? Nasagot ba, Ma'am Virgie? Are you satisfied? Thank you so much. Next question, please. No more question? Okay, so that's end our presentation. Thank you.
Thank you very much, Sir Henry.
Thank you, everyone. Hindi namin naakalain magiging madugo tong competition na to.